Hello friends, I am Dr. Rajiv Agarwal. I am Principal Director Cardiology at the Max Smart Super Specialty Hospital in Saket, New Delhi. And I'm going to talk to you about the latest technologies which are available to us, especially in the field of coronary artery disease. Coronary artery disease, as you know, is a disease which affects the blood vessels supplying the heart. And when these vessels are affected, then some people will get chest pain, which we call angina. And in more severe cases, you may suffer a heart attack and many other adverse consequences. It can be life-threatening. So we need to be able to detect this disease at an early stage, and this will lead to the proper, complete and early treatment and preserve life. So when we are clear that somebody has a heart attack, then of course we go for immediate admission, coronary angiography and putting stents. However, not every patient can be straight away offered coronary angiography, and certainly people don't want it. So we tell people who are especially approaching middle age or who have high blood pressure, diabetes or high cholesterol to undergo various tests, which include simple things like getting an ECG done, getting a health check done, which includes your blood sugar, your cholesterol level, etc. Also, in the cases which warrant it, we want to do echocardiography and stress test. So stress test is something which can be done purely with ECG. We call it the treadmill test. We can do it along with echocardiography, which is called stress echocardiography, which is quite an effective method. It is also done with nuclear isotope, which is called the stress myocardial perfusion test. All these tests are available at big hospitals, including our own. And in my experience, I have found that in many cases where the patient has come with symptoms, we can either, by doing these tests, reassure the patient that the symptoms are not due to the heart and you can rest assured, or if the test is not satisfactory, then go for angiography, go for angioplasty, and that can actually be life-saving. Short of angiography, many patients can be offered a technique called CT coronary angiogram. CT coronary angiogram will show you your coronary arteries even without admission. It is an OPD procedure done in our X-ray department on a special CAT scan machine. And the latest varieties of these machines will give very accurate pictures, and of course they are available in big hospitals like our own for the patient's benefit. There is even a technique called CT calcium scoring, which will cut down on cost and time and will guide us about the patient's risk even without giving coronary dye to the patient. So there is a wide variety of techniques. There are many more techniques which maybe will be required in specialized cases. Like there is a PET scan technique available where if we are not sure whether the patient's myocardium is irreversibly scarred, we can do a PET scan and we will be able to pick up abnormalities in that and better guide the treatment. Cardiac MRI can also be done, which is magnetic resonance imaging, another non-invasive technique whereby we can look and have a very detailed view of the structure of the heart muscle, its metabolism and its viability. Fortunately, all these techniques are freely available with us and they are available to improve the care of our cardiac patients. We should be alert to the risks that we have, especially with advancing age, and not stint about getting the tests done, because a stitch in time saves 9. and you need to be proactive in order to preserve your health. Thank you and Jai Hind.